Hi, this is Dr. Nisha Vishnu, and in this video, I'll be talking about brachytherapy. Brachytherapy or internal radiotherapy is one of the radiotherapy procedures used to treat cancers. Here, we place radioactive sources directly into the tumor or very near to the tumor. What is a radioactive source? It's an element which can emit radioactive rays which has the capacity to kill the cancer cells. So, when a radioactive source like say iridium is kept in the immediate vicinity of the tumor is actively killed by the radioactive rays emitted by the iridium. Since these rays cannot travel far and it dissipates its energy within few millimeters, only the tumor area is affected or the tumor affected area is affected, while normal structures in the vicinity is less or not affected. So brachytherapy is different from other forms of radiation therapy because it allows us to administer high doses of radiation to the tumor area, but damage caused to the nearby normal organs are much lesser. It can be used as a single therapy or in combination with external beam radiotherapy. Sometimes it is done after the surgery, sometimes as an alternative for surgery. Most times we use brachytherapy to cure the cancers. Rarely we use it to palliate the symptoms. In which cancers do we use brachytherapy? Most commonly cervical cancer, that is cancer of the mouth or the opening of the uterus, and for the cancers of the uterus itself. Other less common situations wherein we use brachytherapy is for the cancers of the breast, prostate, food pipe, cancers like soft tissue sarcoma. How do I explain, what is a soft tissue sarcoma? Vaguely put, it is cancers arising out of your muscles or muscle-like structures. More rarely, it is used for cancers of the tongue, mouth, lip, eyelid, skin cancers, etc. If you ask me what the side effects of brachytherapy are, I would say it depends upon where or what site of the body it is being done for. For example, a lady who undergoes brachytherapy for cancer of the cervix may have pain in the perineal or the lower abdominal area, tenderness, that is pain on touching or pressing, some bleeding from the vagina, usually minor bleeding only, some difficulty in passing urine or stools, or rarely infections. Now, these were the immediate side effect and it resolves over a period of time. In long term, we see some of our patients develop bleeding from the anus or the rectum, decreased quality of sexual life due to drying or stiffening of the vagina, or some issues with the urination. Very, very, very rarely, even in the most expert of the hands, we see a lady developing rectovaginal fistula or vesicovaginal fistula. That is an abnormal pathway between the vagina and the rectum or between the vagina and the bladder. This means the patient might be passing stools or urine through the vagina. And this is an extremely rare, but it is a dreaded side effect and should not be the reason for avoiding this life saving therapy. Now, if you see all these side effects are pertaining to in and around the area of treatment. So, if you can imagine someone who is undergoing a brachytherapy for a cancer of the food pipe, none of these side effects will arise. It would be an entirely different set of side effects, wherein the patient develops pain or difficulty while swallowing, and again, very, very rarely a pathway between the food pipe and the air pipe. Brachytherapy can be of several types. It can be temporary, that is, we place some applicator inside you through which the source travels, deposits its energy, and comes back. So nothing stays in your body. In permanent brachytherapy, we place the source permanently inside your tumor and hence your body. It was done for prostate cancers, but nowadays rarely done because of availability of better techniques, and also because once the source is inside, the patients become radioactive as well, limiting their ability to interact with other members of the family, especially children and pregnant ladies. Most commonly used ones are intracavitary, interstitial, and intraluminal brachytherapy. I'll be talking in detail about each of these common techniques in my upcoming videos. Thank you.